The Senate passed a multi-billion-dollar emergency package to combat the coronavirus Thursday. The $8.3 billion deal garnered bipartisan support. The House approved the legislation a day earlier by a vote of 415 to 2. The bill is now headed to the White House, and President Trump is expected to sign it. Grace Segers joins me now from Washington. She's a political reporter for CBS News Digital. Grace, Vice President Mike Pence now admits that the United States does not currently have enough coronavirus tests to meet the expected demand. Senator Patty Murray is the top Democrat on the Senate Health Committee. So I want to play for our viewers what she said earlier.
I have the same questions that everybody I represent have, is what is the truth? I have been hearing for several months now that CDC has tests so we can just know how many people have the virus and how to keep it from spreading. They sent tests out, then they didn't work. They told us there would be millions of them. There are not.
So, Grace, earlier this week, the Trump administration promised more than 2,500 kits would be sent out. What happened?
So they still have yet to live up to that promise. Vice President Pence said on Wednesday that these 2,500 kits would be sent out. And although it's only 2,500 kits, they could do tests for 1.5 million people. But still, there are 330 million people in this country. So that's not quite enough to do a fully comprehensive test to make sure that those who are concerned that they may have the coronavirus actually have it or don't have it.
But I'm trying to really understand what happened here, because we heard from the Trump administration earlier in the week in this big press conference that they had the tests. The tests were going out. And then we hear from the vice president today, who's heading up this task force on coronavirus, his mea culpa, essentially saying we don't have enough tests. Did they just get the number wrong? What fundamentally changed between when we heard the White House before and when we're hearing them now?
So some of the tests that went out earlier to state and local governments had flaws. So the results that they came up with were inconclusive, and therefore they weren't able to be used adequately. So there have been tests that have gone out, but they haven't been as useful, and there still have yet more tests to go out. And I think what you heard from Senator Murray is a frustration that you've seen on the Hill, that no one's really sure how many tests are available, when they're going out, who can use them. And part of that frustration motivated that big spending bill you just saw pushed through Congress.
So let's talk about that great big spending bill, $8.3 billion. Tell us what that's going to buy our country, a breakdown of really where this money is going.
Right. So $7.8 billion of that bill is going to go to government agencies. Most of it's going to go to the Department of Health and Human Services and departments within that agency, like the Centers for Disease Control and Prevention. Then you also have an additional $500 million, which is going to allow Medicare to provide telehealth services for seniors, meaning that seniors can stay at home and still receive medical services, because the elderly people are probably the most vulnerable demographic to the coronavirus right now.
Well, the deal also includes funding for research and development of vaccines. So I'm wondering, Grace, if you have any information about where the vaccine process currently stands.
Right. So the director of the National Institutes for Allergy and Infectious Disease, Dr. Anthony Fauci, who has been really a public figurehead of the administration's response, he told the House yesterday that we're about 6 weeks away from a phase 1 trial of a vaccine, but vaccines take a really long time to develop, and that trial is still probably means we're 18 months or so away from an actual developed vaccine.
Kentucky Republican Senator Rand Paul voted against the bill. What was his rationale?
So Rand Paul is a libertarian, and his big axe to grind is big government spending. So he really objected to the $8 billion price tag, and he offered an amendment to the bill that would have resulted in $8 billion in cuts to unspent foreign aid. But unfortunately for him, no one joined him on that crusade. That amendment was tabled, and the bill ended up passing 96 to 1.
So we all know that President Trump is expected to sign it. When do we think that this will happen, and how quickly does that mean that the money will get to where it needs to go?
We aren't exactly sure when the president is going to sign it. He hasn't given an indication of when that will be. I expect that would be within the next few days because this really is a crisis. The fact that Congress was able to mobilize and act so quickly on a bipartisan basis, which is incredibly rare in this day and age, really shows the urgency of this issue. And I think President Trump has been really eager to show his leadership during this time of crisis. So I think that we're going to see this signed sooner rather than later.
Yeah. Thank you, Grace.
Thank you.